All right, guys, so we're going to be talking over our equipment setup this morning. So whenever you do and whenever you're checking your emergency equipment, you need to make sure that you have 2 suction canister tubing. You need to have a non-rebreather mask, the Yonker. You need to make sure that you have your green, a lot of people call it a Christmas tree, but this is the oxygen connector valve, or this is what you connect to the valve. You need this in order to be able to plug your non-rebreather mask in, or any other oxygen equipment that you may need. And then you also need to make sure that you have a bag. We use, we've been using just like normal white trash bags, but I personally think we should start using these patient belonging bags because you can see through them. And if you just put where it says patient belongings on the back side, you won't have anything that's obstructing your view. So this is why it's a little hard. You know, you can kind of see through the white bag, but it's just a whole lot easier if you have that clear bag. When you're looking, you need to make sure that you have your regulator and then your suction canister. There is a liner that is inside of this, so you need to make sure that you have the liner. On the liner, there are ports. You need to make sure that whenever you want to use this, you have to have all the ports covered by something. So you need to make sure that this big one is covered. This one says like ortho. I don't know if you can see that, but it says ortho. This one says vacuum, and then this one says patient. So I'm going to cover up the one that says ortho because we're not going to use that one. I'm going to leave the one that says vacuum open, and then the one that says patient open, because there's going to be something that goes on those. This red part right here is what's going to go in the vacuum port. So that will go there. So now we only have this one open, and that will be where one of our suction tubings goes. So sometimes you'll see on these red liners, sometimes you'll see one of these. You can keep it on there, that's fine, or you can take it off, it doesn't matter, but this just allows for it to swivel and still be connected. So there's going to be 2 spots from the wall regulator to the suction that you need to plug your suction tubing in. So there's a white spot right here. That's what connects the red tube to the actual canister. So you need to plug one in right there. And then you need to plug one in right here on this regulator. All right, so the other portion is going to be the one that's coming from right here that goes to your patient or the Yonker. If you ever have to use a Jada with this, Jada does have its own suction tubing, so you don't really have to use this for suction tubing anyway. It's not long enough, so you'll have to use the Jada tubing. So you'll plug that there, and then this would go to the Yonker. You can leave the Yonker in the packaging, but this is just so you know that you're ready in the case of an emergency. So now we need to make sure that it actually is functional. So we're going to turn it on regular. So you can kink it, and you see that needle move from where it was once at. That means we have negative pressure in the suction canister, and that's what we want. That's what makes it actually work. So we need to make sure that we're checking it to make sure that it works. Now I'm going to put the bag on it. I'll put the Yonker and the suction tubing in there. And then you got to make sure that you have your green connector, the oxygen connector valve, and make sure it works as well. Because remember, this equipment, it can be in here, but that doesn't mean it's functional. So we always need to make sure that we're checking it. You should also have your infant ambu bag and then your non-rebreather mask. So this is your setup. If you have any questions, please, please, please do not hesitate to ask me, a charge nurse, or Jennifer. We want to make sure that you guys have everything that you need in the event of an emergency, because those can be very stressful, and if your equipment is not ready, it makes it even more stressful. Set yourself up for success when it comes to these emergencies. All right, so we've already talked about setting up our equipment just for everyday use in the room. Now, if you have an emergency and you need a JADA, I'm going to show you how to just be a little bit more confident in that. So in this JADA box, we have the JADA itself, we have suction tubing, and that is 12 feet long, and then we have a 60 milliliter syringe that's luer locked. Make sure that even after the provider inflates that balloon with the sterile water, that you keep that, because in order to remove the sterile water, we're gonna need that as well. So just make sure you keep that. The other thing that you're gonna need is sterile water, and that's gonna be in the hemorrhage cart as well. Another thing is you're gonna have to set up the suction tubing. So whenever you get that, and you're like, okay, I need to set up the suction tubing, rip the bag open, untie it, whatever you need to do. And then you're just gonna take this one off because you don't need it because it's hooked up to the Yonker, and just put this one in place, and then give the other end of the suction tubing to the provider so they are able to hook up that suction tubing to the JADA. And there we go. And then just remember, whenever we have the JADA on, it's gonna be at 80. If you have any questions, please don't hesitate to ask. And I'm working with a rep to come see us soon so we can get some more demos, so we can feel a little bit more comfortable when we are assisting with JADAs in the event of a hemorrhage.